So I practice in a state where marijuana is considered to be illegal. I consider it to be a drug-drug interaction and typically would not allow a patient to be using both substances at the same time. So it's usually one or another. And then I think there's also a lot of nuances with the substances within the product itself, whereas THC has less pain relieving properties and more of the psychoactive side, whereas some of the other cannabinoids that are in there would have more of the pain relief and less of the psychoactive side effects. So I think it's very important, the specific component that's in the product. But my stance has always been one or another. Gotta pick.
So I live in a state where medical marijuana was legalized as of last year, I believe. So billboards are popping up, medical marijuana clinics are available and open for business. And I have seen some chronic pain patients turning to the medical marijuana clinics for potential treatment options, kind of hoping that this is something that will work for them, or even being referred to these clinics by their private physicians. My opinion is that at this point, we just don't know enough about marijuana in terms of using it for medicinal purposes. So of course we have these small case control or other type of small trials where different products or formulations of marijuana have been used for chronic pain purposes or compared to other pain treatment modalities, or patients have been allowed to use the marijuana on top of whatever pain management modalities they're already prescribed. So the data is very limited at this point. It's not standardized in terms of what formulation of marijuana they're using. Even the route of administration isn't standardized. So really what I think we should be calling for is better data, better studies, looking into the potential uses of marijuana before we start turning to this product or substance as the potential, cure for chronic pain. Obviously there's been other studies done for medical marijuana for other disease states, but for chronic pain specifically, I think the jury's kind of still out there. And we know that there are potential long-term side effects with marijuana use, just like there is with opioids. So again, I don't think it's this magic bullet that everybody might, or it may be labeled as that, but I don't really think that that's necessarily the case.
I know that there have been some studies that show marijuana lowers opioid doses, but then that's kind of countered by showing that there is increased risk of aberrant opioid use. So it's I agree that we don't really have good answers because it hasn't really been studied to the level that I would want it to be. But yes, there's certainly evidence out there.
And it's regulated, at this point it's a state-by-state basis, right? So my state does it differently than California, Colorado, and who's to say who's right or who's wrong, but there's no governing body or regulating body kind of monitoring these clinics, the products, even how the providers in the medical marijuana clinics are treating their patients. I don't even know if they do urine drug tests in a medical marijuana clinic, but it's definitely, like you said, that there's potential for drug-drug interactions with opioids or other types of CNS depressants.
Or, we see increased risk for motor vehicle accidents. Mm-hmm. So, I mean, there's good and bad with lots of things. I do think it kind of takes away, I know we're pharmacists, so a lot of times, we're obviously focused on medications, but there's also lots of non-medications things that we do offer and suggest to our patients, and those are probably, if not more important than what, the medications we have to offer them, that are active treatments and, get the patient involved and participating in their care. And so again, I think that takes away from kind of that shift towards that focus and use of other, non-passive approaches.